This part 12. Oh god, this is very long. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay. So today we are going to discuss about Anderson's and Patela's criteria, obviously, which is very important criteria, and the large chunk of today's video will be artificial artifacts in Humphrey field analyzer. So let's move to the Anderson's and Patent's criteria for diagnosis of glaucoma. So in this case we have three things, 3 points. Okay, first point is very important. Just understand this. What are the 3 points that we must consider, and when we see these things we must be cautious that it can be earliest sign of glaucoma. Okay, one is very important. First, it's cluster of three or more points on which graph, which image pattern deviation plot. So in which out of three or more, and at least one should be less than one, p should be less than 1 point. And remember that three must be in cluster, not in side by side. Okay, not in 1 point, 2 point, 3 point, not in. Three must be in the cluster, and out of three one must be at least less than one out of three. Okay, so expected in the visual field. So we have to look at pattern deviation plot, and out of three minimum there must be three, and out of three minimum at least one has to have p value less than 3. Okay, second important point is pattern standard deviation abnormal at the level of p less than 5. I have already told you that if there is no p in pattern standard deviation or mean deviation, you don't think about it. It just you left it, you consider it normal, finished. But whenever there is pattern standard deviation and whatever number there, obviously it doesn't have plus or minus, whatever number it has p less than 5%. At that particular point you become cautious, because one of the Anderson's criteria fits. And another criteria is glaucoma Hemphill test outside of normal limit. Okay, in these three things, it's very important that you see meticulously. If any one of the above criteria met, glaucoma should be suspected, provided that visual field defect is repeatable on a second visual field test in a similar location, and it's not attributable to the other pathological findings such as non-glaucomatous ophthalmopathy and choroidiopathy. Basically means, if out of three, if any criteria meets, then you definitely consider that criteria in your head, and you took follow-up visual field test, and again you check for that particular criteria if it is repeated or if there is any changes. Okay, that's very crucial that you consider Anderson's criteria. Okay, another thing, another criteria that you pick and you think behind your head is that criteria for early generalized depression. Pick up early glaucoma. That's, see, in pattern standard deviation we generally talk about a pattern deviation plot. Again, glaucoma outside, this is pattern deviation plot, but obviously pattern standard deviation is created by not pattern standard deviation, but pattern standard deviation is not created by pattern deviation but created by mm, total deviation. But in this case this is also criteria, this criteria comparing mean deviation index in other eye. It's very important that you see it in early case of diagnosis. One is 2 decibel difference in mean deviation of the index, you must be cautious if there is. And another 1.5 decibel difference in mean deviation in 2 consecutive tests. If there are 2 consecutive tests and then you find every time 1.5 decibels and difference in mean deviation. And another is an average difference as small as 1 decibel in 4 consecutive tests. Whenever consecutive test number increases, you become more and more cautious if there is even 1 decibel difference in mean deviation. Okay, that's very important. So now let's move to the rest of our chunk of the video, that is learning effect and artifacts, okay, of the automatic perimetry. So first there is learning effect, means the patient performance improve with the learning and experience. This phenomenon is called learning effect, isn't it? The first time you put your hair into the machine, and there are a lot of things going on in the patient's eye, and patient don't know how to respond, and patient don't know the pattern. So by time it begins to become better. So learning effect greater for periphery rather than the central stimulus location. It's very important. Learning effect always stored in the periphery. There is peripheral defect can be seen. So to minimize the learning effect, it's advisable to conduct practice test procedure, that's demonstration. There is one small setting that called demonstration. So okay, you can give patient the demonstration of the machine, okay, which is very helpful whenever you are particularly doing the test. So now we are moving to hardcore visual field defect. So I think this is one of the fascinating point that you can understand is people uh, that basically myos people, because mydriasis has less effect, but myos people has greater effect. So pupil size matters, especially pupil size. The testing of pupil size less than 2 mm matters most. Okay, so less than 2 mm diameter can produce artifact. The size of the pupil should be constant from the test to test. Is basically very important. You must look at the size of the pupil, or at least you must be cautious that if size of the pupil is less than 2 mm, it's very much chances in case of geriatric patient. Okay, pupil size can be affect retinal illumination and influence the visual field sensitivity. It's very important. So constrict pupil dims both intensity of the stimulus and the background, isn't it? Because light is constricted, as we have discussed in the our previous video in optics, retinal true-land, isn't it? So retinal true-land, retinal illumination depend upon what? Then entrance people is dependent on what? Real people. If real people is biased, then entrance people definitely get biased, and the retinal true-land decreases. Okay, retinal illumination decreases. So this is the picture, very fantastic. We see in this particular picture 2 mm is the size of people. So you can see even grayscale there is a defect, isn't it? Ring like defect, and the same defect is seen here. But at the same time, can you see mean deviation -8, pattern standard deviation 10.77? So p value is 0.5, isn't it? That's fantastically low. And then whenever pupil size become 3, same patient, can you see anything? See, p value 5%. P value in mean deviation decreases by almost 5 times. And is there any particular defect? No. Yes, there is somewhere, but it's not like that, isn't it? It's very, very, very funny that you can see this change even 1 mm diameter. So that's why you understand one thing. Sometimes it is suggested that if people size is so much, like less than 2 mm, it is even suggested that dilation and doing visual fields is better, because actually dilated people do not cause that much robust destruction of visual field than minus people. It's very important. Okay, media opacity, we know it from the very beginning of the presentation that ocular media uh, opacities reduces the brightness of the test stimulus and background equally. So overall depression of the retinal sensitivity is very important. Overall depression of the so one of the method that we actually find how to eliminate these things is basically pattern deviation plot, isn't it? We have discussed a lot. So it reflects the change in total deviation plot, so, and global indices. So that's why we do pattern standard deviation for this, and this, isn't it? Cataract, vitreous, hemorrhage, corneal opacities, and all this case. So, so can you see in this picture? So because of what? Because of the media opacity, it's basically you can see total deviation probability plot. But whenever we shift to pattern deviation, isn't it normal? It's very good, isn't it? Mean deviation there is a problem, 9.6, but in pattern standard deviation there is no p, means pattern standard deviation is good. Basically means the problem is there in total deviation. Whenever we correct it for pattern like seventh point, we minus 7 point, then pattern standard deviation is okay. Then what is pattern deviation is okay, so everything is okay. So basically generalized reduction of the height of field of vision. Okay, so fatigue effect, it's real effect, you can see this effect. Okay, especially patient who cannot concentrate and fatigue. Okay, difficult in maintaining attention. That's why we always wanted to finish the test as soon as possible, so that patient um, we can prevent patient become fatigued, isn't it? So this becomes more pronounced as the examination time increases. That's why examination time matters. So in this fatigue effect, particular term you will face in your exam too, clover leaf pattern, in which the patient perform well at the beginning of the test and becomes inattentive with time and fail to respond the stimuli. So it may also be associated with a high false negative rate. It's very important. Patient fatigue usually begins approximately after 3 minutes. Just understand this one. Longer duration of the examination, more sensitivity decreases. Very important. That's why we always choose if patient fatigue quite um, easily, then sita fast would be our priority, isn't it? Sita fast. It's almost 5 and 5.5 minutes. So cloverleaf we know, and this kind of pattern is seen, cloverleaf pattern. Okay, in grayscale. So it's very particular in case of patient fatigue. Okay. So lens rim artifact, another artifact that I have seen in my bachelor's first second year. Okay, in basically our institute when I was in bachelor's second year student. So it's very tricky. So I want to talk about lens rim artifact pretty much when. So usually located in 25 to 30 degrees, because it's not located in center, because lens rim definitely was a slight uh, usually in 25 to 30 degree. So lens should not be used in measuring visual field larger than 30 degrees. Very important. Whenever you measuring periphery, you do not use lens. And lens should be placed close as possible to eye without touching eyelashes, because whenever you place lens close as to eye without touching eyelashes, definitely patient can blink. So that if you don't touch with the eyelashes, then in particular case, so if you place lens close to eye, then definitely visual field increases, isn't it? Simple. So can you see in this picture this type of rim defect? And especially rim thicken is lower side of the visual field. So the most important point one should know, in many times we will be observing pseudo field defect due to lens rim. It's very important. Pseudo field defect. You can see this term. So it is very important to recognize this artifact. So how to recognize it? See, typical lens rim artifacts are easier to recognize because they tend to be absolute and sharp demarcated. That's a very good point. Very good point. Very, very good point. It's a clinical interpretation. It is absolutely absolute and sharp in demarcation, not fuzzy demarcation. Sometimes arcuate scotoma start from the blind spot may appear due to the lens rim, and usually they do not widen on the nasal side. Usually they do not widen on the nasal side of the course, and it will disappear subsequent test with the appropriate position. So that's the goal, isn't it? It will disappear if you position the lens correctly. Second, when the lens is too far from the eye or not properly centered, its rim can produce sharp demarcation absolute defect. It's very important. So that's why it should not be too far, it should be close, and it should be properly centered to the eye. Okay. So another, if the lens is not placed sufficiently close to eye, it may produce sometimes double arcuate defect, means complete round defect from upper half from lower half. That's why lens should be placed as close as possible to eye, but no, definitely not touching patient's eyelashes, because they can blink easily. Okay. Another, this is my favorite. Okay. Uncorrected refractive error defocuses the target, thus reducing the luminance of the stimulus on the retina. Okay, first, this is the great point you can see. This is very good. I have been asked when I was in third year in Viva, this question was there. In this case, 6 by 6 visual acuity with the corrected, if the field testing was done, the proper refractive correction and the measure of favorable threshold should be approximately 36 decibel. It's completely okay if there is 35, 34, 37, whatever. In around 36, 6 vision means foveal threshold in around 36 decibel. And that was the time I was. It's very funny story. Actually, I didn't want to tell you, but it's I have been asked. Okay, so 6 by 6 means 36 decibel gross. Just take it as a rough idea. Whenever you see patients report card, patient's OPD file, and you see 6 by 6 at the same time in visual field. You see, like, foveal threshold is 29, and this remember, then you should remember that there is something going on with the refractive correction. You can think that particular point, okay? So I can, so you see, if 4 diopter spherical defocus, see, isn't it? So minus 6.15 decibel differential in sensitivity. So generalized reduction. Even see, MD is how much? But at the same, PST is good, isn't it, in both cases? But whenever the correction is done, then see, it's gone, isn't it? In glaucoma infield test, see, generalized reduction. But whenever it's gone, everything is good. So that's how it affects. So, high myopia error can create areas of retinal rod that appears as a vertical waves and type defect and may confuse with the glaucomatous visual field loss. The rule of thumb would be correction of refractive error even as low as 1 diopter. That's very important. Significant cylindrical defocus being induced when astigmatism is greater than 1. Okay. In case of presbyopia, Humphrey visual field analyzer is match data and add the determine appropriate color. You don't have to worry about presbyopia. You put the data and you put refractive, everything will be given to you. So another eyelid and facial feature that matters. You see when geriatric patients they have this problem. Superior lid ptosis cause superior visual field defect, isn't it? See here, it's basically lid defect. Large node can mimic the defect in inferior nasal steps, and overhanging brow, even eyebrow, and deep-seated eye can lead to superior field peripheral artifact defect. That it's very important that you understand whenever you do visual field in case of geriatric case. Okay, that there is you can see these things in geriatric patient. So this thing we never talk about generally because head position matters, I think, most whenever you are doing visual field. So uh, how? Let me tell you, the head must be also be placed against the headrest in order to prevent artificial altitudinal defect from forming. As a result of the position not being able to see the stimuli present in the inferior field. See, that's the point. If you put your head position not in an appropriate way, chin and head position, then you cannot see a particular field stimulus. That's why there will be defect like altitudinal defect. If head is turned temporarily, the nose may appear and considerable obstacle and even in the central 30 degree. So if head is tilt and blind spot may be elevated and there is definitely fixation loss problem. So it's there. So let me show you. Isn't it? The head is not appropriately at head raised, head is tilted now. So it will create problem, isn't it? Poor head fixation visual field testing and temporal head. So that's very important that you understand these concepts. Okay, the chin must be at chin rest, head should not be tilted, and head must be at head rest. It's very important. Trigger happy patients. Sometimes you see this type of patients. Okay, some patients, particularly if they are anxious and will be eager to see most or even all the stimuli during test, because many of the patients want always 10 out of 10, isn't it? So they are happy, so will press the response button as often as possible, resulting large number of false positive. So trigger happy means large number of false positive. So trigger happy field characterized by the patches of abnormally light is very important. There are patches of abnormally dark, isn't it? But abnormally light area of gray scale plot due to abnormal high threshold. So it's look like this. Can you see abnormally high patches, clear patches? So in this particular case, so you must see here fixation loss is high, false positive is really high in this particular case. So it's double x, isn't it? So you must understand this. Hysterical visual field loss and malignant. If there is hysterical or malignant, then example function loss, visual field loss, such a visual field plot are best assessed with the kinetic test, means Goldman ball parametry. In this case, you see like this type of pattern, spiral defect. So this is particular defect you can see, and this question I think it it will appear in your MCQs. There is chance. Okay, hysteric or malingering, which type of visual field defect you will see. Artifact, basically. If I don't know, it's defect or artifact. Definitely artifact. It's called spiral defect. Okay, it's very important. So at last, I think the best book is GRAD's book, and definitely I have taken a lot of visual field effect from this book too. So this is it, I think. So Bistan, choose.